My name is Alex Middendorf. I'm an assistant professor of pharmacy practice. So my role is a bit unique. I am a 50-50 faculty member, meaning that I spend about half my time at my community pharmacy practice site, and then I spend the other half doing college and university related things such as teaching, research, and service. So with my professional practice site, it's actually associated with our postgraduate year 1 community pharmacy residency. So I go to the pharmacy site there in Sioux Falls, Lewis site, and work with the pharmacists and pharmacy residents and walk through medication therapy management visits and other clinical services at the site. Topics that I teach are community pharmacy focused, given that is my specialty. So I teach medication therapy management, communication, different community pharmacy based services, self-care therapy like over-the-counters, and then I oversee our P4 community pharmacy, advanced pharmacy practice experience as well too. So my past research experience is quite varied. I'd probably categorize it in 2 groups. One of my larger studies was focused on the use of health information exchanges to optimize community pharmacy care offerings and service offerings. And then I've had a few projects in the area of scholarship of teaching and learning. So my first project that I wanted to visit about was using the South Dakota Health Link, which is our state's health information exchange. What we did is took this state health information exchange, which has pretty much all the big health systems for the most part in the state. It's a very up-to-date and complete record of care. And we put that in the hands of our community pharmacists who are providing some advanced medication therapy management and other clinical services. What we found in that project is that pharmacists were more confident in the services they were providing. They were able to find more problems that required resolution, and it didn't require as many contacts with a doctor to get those resolved. For the Scholarship of Teaching and Learning projects, most of mine have focused on use of new technology in the classroom setting. I've also done some Scholarship of Teaching and Learning focused on interprofessional education activity development, where we have our pharmacy students working with other health professions, whether it's other ones within our college, like medical lab science, respiratory care, public health, but also with nurse practitioner students and nurses. So I had a few different projects that focus on that. So the main project that I'm working on right now is the project through CPIC, which is our 5-year CDC, South Dakota Department of Health project that focuses on trying to care for South Dakotans as related to their diabetes and heart disease, and really by leveraging the role of pharmacists to provide and optimize the care that those patients are receiving. So we're in the middle of year 4 of that project. I've been in it since the beginning with our primary investigator, Cheryl Pinto. My role, again, was focused on the implementation side of things, really working with our partners, and I'm one of 2 currently practicing pharmacists on the research team for this. So with my role as community pharmacist, we do have some community pharmacy stakeholders, so really trying to take what we want to do from a research perspective to have a really comprehensive and well-designed study, but also making it realistic for our pharmacists to implement. Continuing to work with CPIC, continuing to work with the faculty that I'm working with right now. We have a lot of opportunities based on what we're seeing with our current CDC and South Dakota Department of Health project for diabetes and heart disease and leveraging the role of pharmacists. Certainly also looking to spend more time working with the State Health Information Exchange, South Dakota Health Link. I feel like this is an excellent tool, and we have a great opportunity in South Dakota to continue to expand it, to really see how having perhaps pharmacy data in there where you're able to get a accurate medication list without a whole bunch of phone calls and faxes, and how much that impacts care. What CPIC provides is there's expertise there, there's faculty and staff members who have that formal research training and have that expertise to really help us out. Being able to have somebody who is tuned in to that will just make the process a lot smoother for us to perform research and allow us to make our research projects as robust as they possibly can. They also will continue to have at CPIC all of our stakeholder relationships, so rather than just maybe doing a study or a pilot at my one practice site, maybe there's opportunities to work with other stakeholders and make it a far-reaching one.